Hi, how's it going? My name is Dan Reddington. I'm a physical therapist at OrthoNorCal.
And hello, I'm Dr. Robert Cagle. I'm an orthopedic surgeon who specializes in joint replacement surgery of the hip and knee here at OrthoNorCal.
And we're going to be talking about knee range of motion post-operatively, knee strengthening post-operatively, and general guidelines to prevent blood clots or deep vein thromboses. All right, let's get going. We're going to be talking about some post-operative guidelines to kind of get you up and moving again. We're going to start off with some knee range of motion exercises. The number one thing that we want to focus on post-operatively for our knee is restoring full range of motion and really emphasizing our knee extension range of motion. Meaning we want to make sure that we can get that knee as straight as possible, as early as possible.
I would like to reiterate that again. For me, as the surgeon, when I see you at your first post-op visit, the thing I'm really focusing on early in the game is being able to get your knee fully straight and get that knee extended. So we'll go ahead and demonstrate that for you right now.
All right, so we're going to have Dr. Cagle swing his legs up on the table here. We're actually going to have you sit up for us right now, and we're going to work on, have you slide back a little bit here. We're going to work on, again, getting that knee as straight as possible. So we're going to bring this around the back of the foot there. Good, and we're going to have you hold with one hand, and we're actually going to have the other hand push down on the top of the femur there, or the top of the thigh, to really get that knee extended. To give us a little boost, what we can end up doing is putting a little bolster, a little towel roll underneath the foot right here, so it gives us a little bit more leverage to really get that knee as straight as possible. When we're doing this here, we want to try to hold for about 30 seconds and take a break. We're going to have you do that a few times per session, and we're going to be doing these throughout the day to make sure that we can achieve knee extension and maintain knee extension throughout that day.
And like right now, I can definitely feel a small burn kind of through the back of my knee. That's how you should know you're doing it correctly.
Awesome, awesome. We're going to work on a couple other strategies that we can use to make sure we're getting that knee completely straight. So I'm going to steal this strap away, and we're going to have Dr. Cagle here lie on his stomach with his legs off the edge of the table here. We're going to put a little pillow underneath the thigh, and we're going to lift up there. Now, a big thing here as we're doing these are called prone hangs, is we want to make sure that that kneecap is clear of the table. We don't want to have the kneecap being pressed on the table at all. So in this position here, you can see we have that knee stretched out, and we're having gravity help us here by pulling his foot down here. Again, like he was mentioning in the previous exercise, you're going to feel a burn through the back here. You're going to feel a big stretch through our hamstring muscles there. To increase this stretch, what we can do is put a weight or a bag around the ankle here or foot and allow gravity to pull that down a little bit more so that we're getting more force coming down towards the ground and really working on stretching out the back of this knee here.
I personally love recommending this exercise for my patients because you can do it very easily at home by yourself. I could be watching my iPad, I could be reading a book, looking at a magazine, watching television, and you can take household items such as soup cans or bottles of water and put them in a plastic bag and literally hang it off your ankle and do physical therapy without actually having to actively do anything other than read, watch television, or whatever you enjoy doing.
We're going to talk about a couple other strategies that we can use to make sure we're, again, getting that knee all the way straight extended. The first one here is going to be seated here with our foot out in front of us here. Pretty simple. All we're going to do is put our hands on our thigh here and push down towards the ground as much as we can tolerate there. Good. Again, big stretch through the back of the knee there. We want to really try to force that back of the knee down towards the ground so we can get that knee fully extended here.
And I want to reiterate the fact that there's a concept of that this is going to have some stretch pain in the back of your knee. You aren't going to damage your knee replacement or knee surgery by getting your knee fully extended. Feeling pain in this instant doesn't mean that you're breaking something.
And now one other exercise that we want to work on here to get that knee fully extended is going to be using a backpack or bag, anything that has a couple straps on it. What we're going to do here is put the foot through each strap here. And we want to have the straps one above the knee, one below the knee here. We're going to set up another chair of about equal height to the chair that we're sitting in, right in front. And we're going to lift that leg up on top of that chair here. So now what we have here is the backpack hanging below the knee, pulling down into extension. And then the nice thing about this here is you can start adding soup cans or weights or whatever you might have available at home into that bag as we start to get more comfortable with it to give it a little bit more force pulling down here. This is something we're going to want to be able to hang in for about 5 to 10 minutes per session with a few sessions throughout the day, trying to really work on getting that knee fully straight.
And again, I can feel that nice, it's an uncomfortable pain, but it's a kind of a burning stretch sensation in the back of your knee. That's how you know you're doing it correctly.
Now we're going to start talking about knee flexion, where the knee is bending. While we focus on knee extension early on and restoring full knee extension early on, we want to be able to restore full knee flexion by that 6-week mark here. So we're going to work on a couple exercises here that will help us get into that mode. So we're going to have Dr. Cagle here lie down on his back. And this can be done either in socks or with a towel or slider underneath the foot. In this case here, we're going to use a paper plate to put right underneath Dr. Cagle's foot here. And we're going to use a strap around the foot. And that's going to be held on with 2 hands here. This can be done either lying down or sitting up. Whichever you're more comfortable with and whichever you feel like you can get the knee to bend a little bit more with. But with this exercise here, we're going to be pulling back on those straps and sliding the heel along the table here. As far as you can go, we want to kind of push into that painful range there. Once we get into that range where it feels like it's pretty tight, I want you to push a little bit further, hold for a few seconds right there, and then we can slide back down. And this is something that we want to repeat about 20 times per session with that 3 to 5 second hold at the top where we're really trying to push that knee. And this is going to be something that we want to work on frequently throughout the day, making sure that we're continually moving every hour if possible to try to make sure we're not getting that knee to be stiff at all.
And this is a very easy, just gentle motion, but you should feel where that moment of pain, as he said, and then go just a little bit more and hold it for that 3 to 5 seconds. And then again, let it kind of come back down.
All right. And we'll actually have you sit up here, and just so we can see a video of that in a seated position as well. If we feel more comfortable sitting up.
Go a little bit more, hold it, and then back down.
Perfect. All right. All right, we're going to talk about a couple other strategies here to get that knee to bend a little bit more. Right here, we're going to be using a paper plate on a carpet, so it's going to allow us to slide a bit. We're going to have the foot get set up on this paper plate here, and we're going to try to slide that heel back underneath us right here, getting that knee to bend as much as possible. You should feel the muscle right behind the thigh here working a little bit as we're pulling that leg back there. And then once we get to our end range, we can come back out. Another strategy that we can use here is grabbing the leg and trying to pull it under us right here. So we can get a little bit more power through the leg here and really, really push to get that full bend here. Again, this should be uncomfortable at the end range so that we're really getting that full knee flexion coming back.
Perfect.
And then the last one we're going to look at right now, we're going to steal this paper plate away. We want to put a stop right in front of the toe right here. So our foot is planted here. And we're actually going to lean forward in our chair here, trying to use our body weight to be able to get that knee to bend as much as possible. We want to really try to push this one right here. Hold for about 10 seconds. And then we're going to come back here. Good.
And then just kind of finish off from the going to extension to flexion. What I'm hoping for my knee replacement patients is this by 6 weeks. This is an A+ patient where you have full terminal extension of the knee with an active way of doing it through your thigh muscles, and then you simply bend your knee under your own power to get to that 120-degree mark. That is what I consider an A+ patient by 6 weeks after having a knee replacement surgery. If you have any questions or concerns, we're always here to help in any way possible. If you're a new patient to the practice, we would love to see you and discuss how we can help you and better your life and get back to the high quality of life that we strive to give here at OrthoNorCal.
Remember, post-operatively, the key is to work hard and be diligent with all of your exercises. Thank you.
And last but not least, remember, you're not going to break anything. Pain is just unfortunately part of the deal when you're rehabbing a joint replacement surgery. You won't break anything, you just got to get through the pain. Thank you again, and have a great day.